So I had been told by people that I needed to go do global health work, I needed to go do medical missions. They thought it would be really good for me, but that was not what I felt called to do. I really enjoyed serving the underserved population in Indianapolis. I was working at a community health clinic, so people with no insurance or Medicaid or underinsured, that's where I felt I needed to be. And the Burmese came to me. I love working with them. Barrington is a little different than some of the clinics that residents are at because we are a freestanding community health center. We're located on the south side of Indianapolis. About 50% of my patients are Burmese refugees or the children of Burmese refugees, so we have a large international population. Turns out it was about 13 years ago I had one patient who was seeing me, and I had seen her for about a year. She always came with the same interpreter. One day the interpreter asked me if I was taking new patients, and I said, yes, I'm taking new patients. I only see kids, but we have two doctors here who see kids and adults, and we're all taking new patients. And the interpreter looked at me and said, I like you. I will send my people to you. And within a year, we had 100 patients, and then 300, and then 1,000, and it just increased from there. Pretty much all of my days, at least 50% of the patients I see are Burmese. Getting patients to take their medicines and take them correctly has been a challenge from the beginning. In Burma, if you go see a doctor, you're given a course of medicine, you take it, you finish it, and you're done. There's not really a concept of chronic medical conditions or chronic treatments, so kids with asthma would take their inhaler until it ran out, and then they'd never take it again. So trying to get patients to understand about refills and how to go to the pharmacy and how to request refills was a big challenge that we worked on. We also ended up printing out sheets that had different instructions pre-printed on it in English, Burmese, and Hakka, and then we could just circle which one were the instructions for their medicine and give that to them with their medicine name on it and the instructions in a language that they could read. Since then, most of the doctors at our clinic have learned how to write at least basic medication instructions in Hakka Chin, since they use the same letters that we do. My residents certainly get to learn how to use an interpreter and how to interact with different cultures. My residents get to do some travel medicine and travel advice for people getting ready to go. It's something that strikes fear in a lot of pediatricians or the other doctors I work with. They don't like doing it. Although once you learn how to do it, it's not that difficult. It's something they can do and they don't have to be scared of. It's not just the Burmese population we have a Hispanic population, we have families who are refugees from Syria and Eritrea and Somalia. So we really have a diverse cultural population on the south side of Indianapolis. So our residents really get to see true primary care and what to expect for them for their life.